This Millie, I'm going to do my pediatric head to toe assessment, but before I start, I have to scan my room, my environment. Okay. All right. Before I start, I need to recite my safety practices. Verify care and order for client. Perform hand hygiene before and after any client's care and after handling supplies. Verify facility policy and procedure and assemble appropriate supplies and equipment. Consult manufacturer's recommendation if equipment are involved. Knock on the client's door. Identify clients using two identifiers. Know the overall well-being of the client. Explain procedure to clients. Elevate the bed to a good working body mechanics. Don PPE if indicated. Upon completion of task, return the bed to its lowest position. Apply side rails per patient's care plan. Put call light within reach, and if there was any abnormal finding, report to the charge nurse immediately. Okay, so this is my daughter Blaze. She's the one I'm going to use for my pediatric assessment. Blaze, do you give me permission to use you as my to assess you?
Yes, I consent.
Okay. Can you tell me your full name and date of birth?
Like, do you include my middle name too? Or
Just tell me your full name and date of birth.
Okay. My name is Bliss Wake, and I was born 2014, July 23rd.
Okay. So I'm gonna start head to toe assessment. Bliss, I'm gonna start from your skin, okay? Integumentary system. And first of all, I'll look at her hair. It's evenly distributed. No lesions on her scalp. No abnormal findings on her scalp. No tinea capitis. No lice. No nets. It's been washed clean and evenly distributed. Let me look at your skin. No birthmarks noted. The skin is appropriate and normal to ethnicity. No edema noted. No pallor. No jaundice noted. Let me look at your nails. You're all clean and clipped. No clubbing of the nails noted. Give me your foot too. Clean and clipped. No clubbing of the nails noted. And I will assess skin turgor. Okay, she looks hydrated and perfused. Okay, I'll go ahead and assess her head. Her head is normal cephalous, not too big for her body, not too small for her body size. And the features for her head are all evenly distributed and symmetrical. Okay, I'll continue with her eyes. Symmetrical to each other. No edema or anything noted on her eyelids. Her conjunctiva, pink and moist. Open up. Her sclera, clear. I'm going to assess your pupil and iris. Look at me. Her iris is brown and her pupil was reactive to light. Without moving your head, can you follow this pen with your eyes only? Okay, it's accommodating, and we go ahead to assess your outer canthus in relation to your ear. So her outer canthus in relation to her ear is present and even. So as on this side is also present. We'll go ahead and assess her ear. I'll pull down and back. Okay, a little bit of cerumen noted, no drainage noted. Are you hurting in your ears?
No.
Okay, let me pull back. I need to see. So this way I pull back, I pull down and back. Okay, also there's a little bit of cerumen in here, but no drainage noted. Okay, at this moment I'm going to assess your hearing. Okay, you want to step out here.
Happy.
Now I need you to cover your right ear. You voice out as you did the first one the word I will say. Okay,
Holidays.
cover your right ear only, your left ear only at this time.
Everyone.
Good job. So her hearing is adequate. I need you to sit down right now for me. Okay. Now we'll go ahead and assess your nostrils. So let me shine my light in your nostrils. It's pink and moist in the mucosa area. And the septum is not deviated. I need to assess the patency, okay, of your nose. Take a deep breath. Take a deep breath. Her nerves, both nerves are also patent. All right. We go on to your mouth. Open up. Okay, your hard palate is there. No problem with it. No cavities noted in any of your teeth. She is missing her baby incisor teeth, which came out and has not come back yet for the adults. And she has braces on her top teeth. Bottom, there's no missing tooth, no braces there. Stick your tongue out. Good. Her tongue looks okay. Her lips not cracked or chapped. Now I need you to depress your tongue. Don't push your hands down back, okay? Push your tongue down so I can see your tonsils. Down, down, down. Okay, her tonsils are pink and moist, not reddened, and her tonsils are present. Okay. Now I go on to assess your neck. I'm gonna check your head support of your neck, okay? Now can you turn your head around like this? Okay, you have good neck support. Now, no lymph node enlargement noted, and no enlarged thyroid gland, no jugular vein distension noted. I will assess your clavicle. It's present and symmetrical and not broken or cracked. All right. And then her breast and her axilla are appropriate for her age. Now, as I'm talking to her, I'm watching the symmetrical rise and fall of her chest. I can see, let me see your thorax. Okay, so everything looks normal here. Now, let me listen to your lung sounds, okay? And your heart sounds, and we'll continue from there. You will be taking deep breaths for me when I'm listening to your lung sounds. Take a deep breath. 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 And I'll do for her back. Take a deep breath. 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 So on all the auscultated fields, her lungs sounds are clear. I'll go ahead and listen to your heart. Okay. So her heart rhythm is regular. No extra sound noted. No murmur noted. Her S1, S2 present. And I'll go ahead. Well, I'm looking at your stomach, your belly. I'm not seeing anything bulging. I'm not seeing any distension. I'll go ahead. I'll go ahead and listen to your belly sounds or bowel sounds, okay? Okay, so we have normative vowel sounds. I'm going to push on your belly slightly, gentle palpation to feel in if there is anything bulging. No enlarged aorta and no enlarged spleen. Okay, Blissy, we're going to ask, when was the last time you pooped?
I pooped 3 hours ago.
Okay, well that's so normal. Okay, and when you pee, do you have any burning sensation?
No.
Okay, when you pee, can you tell me the color of your urine?
It's bright yellow or yellow.
Okay, and her genitalia is also appropriate to her age. At this moment, I'm gonna assess your radial pulses, okay? And I'll assess your strength in your arms and your legs. And then we'll do tactile stimulation and stuff. Okay, can you pick your feet up for me? Let me assess your radial pulses. Okay. Your pulses, her pulses in her extremity, her wrist, and her pedal pulses are all present. Now let's check your strength. Hold my hands. Give me a good grip. Okay. Now, can you raise your hands up? This way. Can you bend your elbows? Okay, her joints are even and working. How about you straighten up your legs? Bend them. Bend your legs. Okay, now, can you push against my hands? No, I mean push backwards against my hands. I need you to push backwards against my hands.
Oh, okay.
Do you get it? Like restrict my hands.
Oh.
Good. And now push on my hands. Here. Push on my hands. Push your legs. Okay. There. We have strength in it. So I'm going to assess your gait, okay? I need to see how you walk and how you balance yourself. But before that, let me check your spinal cord to see your posture. So she has a good posture. Her spinal cord not deviated and even and symmetrical to both sides. Okay, you want to step down? And can you walk to the bathroom door and come back? Okay, come back to your seat. She has a good gait on ambulation. All right, now I'm going to assess your tactile response, okay? So, this is sharp. This is dull or blunt, okay? You can use any word. You prefer dull or blunt?
Dull.
Okay, so sharp, dull. Okay. Close your eyes. What do you
Sharp.
feel? Close your eyes again. What do you
Dull.
feel? Good. Now, Bliss. Okay. Open your mouth. Open. Okay. No. Can you tell me? You told me your full name and date of birth, right?
Mhm.
Now, can you smile? Close your mouth. Can you smile? Can you frown? Okay. Can you raise your eyebrows? Okay. And you know where you are?
Yes, I am located in my downstairs living room.
Okay. You know what day of the week it is since you didn't go to school?
It is Wednesday.
Oh, okay. You got it. All right. And as I was talking to her, I realized she's Atlanta-oriented times 4. She is very cooperative. Why are you so happy? You can tell she's happy. Psychosocially, she's fine with no flat affect. And so I guess everything is within normal limits and appropriate for her. And this will complete our head to toe assessment on a pediatric patient. Thank you.